closely related disorder, social anxiety disorder, is sometimes also called social phobia. So the primary diagnostic criteria for social anxiety disorder is that the individual experiences marked fear or anxiety about one or more social situations in which the individual is exposed to possible scrutiny by others. So you can see that, like a specific phobia, social anxiety disorder is characterized by marked fear or anxiety, but unlike specific phobia, which could be about any phobic object or situation, the phobic situation in social anxiety disorder is about social situations specifically. We have two different subtypes of social phobia. We have a generalized subtype, which applies when an individual has anxiety about general social situations. So those might include things like meeting new people, going to social events, going to large parties, going to small parties, or socializing in different kinds of contexts. In contrast, we can give the performance-only specifier when an individual experiences marked fear or anxiety about social situations that involve speaking or performing in public. So some individuals don't experience distress or anxiety about social situations in general, but when they are engaged in public speaking, when they might be scrutinized by others, they experience marked fear or anxiety. So an individual whose social anxiety is limited to these performance contexts could be given a diagnosis of social anxiety disorder, the performance-only subtype, whereas an individual who has anxiety about different social situations or a range of social situations could be given a diagnosis of the generalized subtype of social anxiety disorder. So an important component of this marked fear is that the individual is worried that he or she will either act in a way that will be negatively evaluated, or they may be worried that their symptoms of anxiety will be evident in a way that is embarrassing. So this is another important distinction between social phobia and a specific phobia. So in a specific phobia, the type of fear is specific to the phobic object. So the person might be worried that a dog will bite them, they have a phobia of driving, they might be worried that they will crash. But the characteristic fear that characterizes social anxiety disorder is that the individual is worried that they're going to be negatively evaluated in this social context. So again, the distinguishing feature between a social phobia and a specific phobia is the nature of the phobic object. So in social phobia, the situation that is feared is a social situation, and the nature of the fear. So the nature of the fear in social anxiety disorder is that the person is worried that other people are going to evaluate them negatively. The other criteria are very similar to what we saw for specific phobias. So the fear response needs to be consistent. Social situations almost always provoke fear or anxiety. So in the generalized subtype, that might apply to whatever range of social situations the person experiences fear in. In the performance-only subtype, it's going to be a consistent fear response every time they're in a performance setting. There's also characteristic changes in behavior. So either the person consistently avoids social situations, or if they're not able to avoid social situations, they're endured with intense fear or anxiety. Like the specific phobias, the fear or anxiety is disproportionate to the actual threat. So the level of anxiety that the person experiences when facing a new social situation or going into a public speaking context is excessive and disproportionate. And then we have the same duration and distress and impairment criterion. So it needs to be persistent fear or anxiety lasting longer than 6 months, and needs to either cause distress, so the person is bothered by their social anxiety, or cause impairment. So for example, a person may not be able to pursue new opportunities at work because of concerns about anxiety related to public speaking. It may interfere with the person's ability to form new relationships because they avoid different kinds of social situations, or they just may experience significant distress. So they may be very bothered by their social phobia, and they may want to experience less anxiety in social situations. So social phobia shares many characteristics with a specific phobia, but the nature of the phobic object is that this is specific to social situations, and the nature of the fear is that the person is worried that they're going to be negatively evaluated in these situations.